I've never done this before, so I'm a bit scared. Okay. Hi everyone, I am Jo from Wave. I'm not Rachel like my computer says. I'm joined today by Lynn and Becca from Highland Sexual Health Teen Clinic. Thank you both for joining me. Today we're going to talk about sexual health, young people and lockdown. So let's start with contraception. So if I'm a young person stuck at home and I run out of contraception, what can I do?
So, if you've got your implant, you'll have been told when you had your implant fitted that this would last about 3 years. However, we've been given some new advice about this since the COVID-19 outbreak. The guidelines now say that the risk of pregnancy is very small in the 4th year of having your implant fitted. So if your implant is due to be changed, then we can say that even though it's expired, it will still be offering some contraception cover. We can't guarantee that this will 100% be the correct advice, but we would always ensure that you use condoms as well. Or you can get in touch with us here at Highland Sexual Health and we can talk about sending out some mini pills. With regards to the pills, then please do just give us a phone on 01463 888 300, and you can also access our sexual health website as well, and you'll be able to speak to a doctor and a nurse with regards to your contraception needs.
Great, I'll put up a slide at the end of this video with contact details and website and stuff on, so people can just click the link and go directly. So can I still go to my GP surgery for contraception? Are they still open to speak to about the pill or the implant if I need to go there?
So GP surgeries are still open, the same as the hospitals are still technically open, but it's really going to be dependent on what your GP's sort of policies are during COVID. So the best advice we would give is give them a phone. Even though that we're not seeing people face to face, the same rules apply. We're all still available over the phone. So if you normally get your contraception from your GP, phone them as normal and they will have some sort of contingency plan in place that they can help you over the phone.
Great. Okay, so contraception, just ring it and get some advice. That 4th year of implant will still be covered, but I can take the pill as well. What about STI testing? Can I still be tested for an STI?
You can. If you feel you've got symptoms that suggest an STI, then again, we're going to say over and over again, phone us. Our doctors and nurses are all still working Monday to Friday, 9 to 5 as we usually do, and we would just have a chat over the phone. And if they feel it's appropriate, they can arrange to send you out a postal testing kit, which will screen you for chlamydia and gonorrhea. If those tests then come back and they're showing a positive result, we would then give you a phone and discuss how we can get treatment to you without still having to see you face to face.
Great. So the only other thing left to cover in terms of supplies is condoms. Where can we get free condoms at the moment?
Like Becca says, just give us a phone. We're offering to post out lots and lots of different condoms, and that includes latex-free ones as well.
So as everyone is staying at home following the government advice, obviously we're being advised not to meet people from outside our household. So I'm assuming you're advising people the same goes for sex as well.
Yeah. So like you said, government guidelines state we should all be staying at home and not spending time with anyone that we don't live with. So the advice is quite black and white. If you don't live together, you shouldn't be having sex. But it's also just to make clear that doesn't mean that you can't sustain a relationship during lockdown. Make use of Zoom, like we're doing today, or FaceTime and other sort of electronic communications, and stay in touch, because probably now more than ever you're going to rely on your partner for some support. So yeah, it doesn't mean just because you can't physically see or touch each other that you can't still be there for each other and sustain a relationship throughout all this.
Great advice. Okay, so this one's a bit more serious. So if I'm stuck at home and I think I might be pregnant, who can I speak to talk about my options?
So the advice we're given on this really hasn't changed since the very beginning. We would always advise that you tell somebody, particularly if you're in your household telling a family member. You can call the Unintended Pregnancy Care Department at Raigmore, and that's just a self-referral. And again, Jo will put the contact numbers up when we're done. There's always somebody there to offer and give you guidance and advice.
Great. And can people still ring their GPs about pregnancy as well?
Yeah, absolutely. Most people are coming through a self-referral phone number because it's quicker.
Yeah, great. Okay, so I'll put that number up as well as the Highland Sexual Health contact details. Is there anything else young people in Highland should know about their sexual health during lockdown?
I think it's just really important to remember that there's no question that's a silly question. Like we said, we are all still here over the phone. So if you've got any symptoms, any worries, or even just a quick question that you want to ask, phone us. So even though we can't see you face to face, we can still offer you the same support and the same advice that we could do in a face-to-face consultation. And we've also sort of created a frequently asked questions section on our website to cover a lot of the questions you'll be wondering during sort of this lockdown period. But I think the most important thing to remember is follow the government guidelines, stay at home, don't meet up with anybody that you shouldn't be meeting up with, and just bear in mind, the quicker we all do that, the quicker we'll all be back to normal, hopefully.
Definitely, yeah, looking forward to that. Well, thank you so much for joining me, ladies. I will pop this website up, this video up today with the website details and the phone numbers for people. And hopefully we'll get to see each other in person again soon.